Jonas at Whole Body Chiropractor here. I would like to run through some of the common causes of low back pain. As a chiropractor, I see it as my job to help my client to get an as able, well-functioning body as possible. And therefore it's a bit pointless in me fixing their problems if they're causing the same problems in just as high rate. So I want to teach you the things that you need to avoid in your everyday life to be able to get ahead in your care program and actually get somewhere and improve. So here they are. Our first common cause of low back pain is excessive sitting. When you sit, you have bent knees and bent hips, which means that your hip flexors are going to get shorter and shorter, and your hamstrings are going to get shorter and shorter with time if you don't stretch them out. And this is a problem for your lower back because when you stand up, if your hip flexors are really tight, you're always going to be bent forward like this unless you really arch your back up and you put lots of weight through the back part of your lower back spine. So that can lead to degeneration and problems there. And if your hamstrings are short, that means that you're not going to be able to use your hip to bend as frequently and keep your back in neutral. Instead, as soon as your hamstrings max out, you're going to have to bend your lower back to pick things up, and that puts your lower back at risk. So the way to avoid that is to, in your everyday life, build in some stretches, like stretching your hip flexor like this, and your hamstring like this, so straight knee, bending from the hip. And if you do that regularly, you can counteract the negative effects of all that sitting. And that way, you're going to be able to keep on doing your work without getting degenerated bodies. So our second common cause of low back problems is a weak core. And probably one of the best exercises to train your core is the plank position. So just here, trying to keep my body straight, and you can lean onto the wall, to a chair, or the hardest version is to lean straight onto the floor. And you should be able to keep this position for at least 90 seconds comfortably. And when you have a strong core, it's going to be easier for you to keep your lower back in a safe, strong posture when you do lifts and throughout everyday life, and you're less likely to get back problems. Third cause of low back problems is poor lifting technique. So the essential when you're lifting something is that you want to keep it as close to the center of your body as possible and use your legs rather than your back. So I'm bending at my knees here, grabbing this, and use the legs to stand up so my spine is straight the whole time. Now, if I need to lift something that's a lot lower down on the ground, you're going to need quite a bit of hamstring flexibility, and you also need core strength to be able to keep that posture at that very lowest range. So our two previous points actually builds into this. But if I was to grab this chair from really down low, once again, trying to keep my lower back nice and straight the whole way down, so I need that flexibility in my hamstrings to get down there. From here, just hug the object as close as possible, keep my spine straight, so I stand back up. Right. A fourth common cause of low back problems is obesity. The heavier you are, the more weight your spine carries, and that's going to have its biggest effect on the lowest part of the spine, because this part of the spine obviously carries all the weight of the body that's above it, compared to the neck is not going to be as affected since it just carries the head. And the worst sort of obesity for your back is abdominal obesity. The further that weight gets out from your center line, the more damage it's going to cause to your lower back, basically. It's sort of like a seesaw scenario. If I had this as an example of a seesaw here, and the weight is balanced like this, at the moment my hand here only carries the weight of this foam roller. But the further I put it out, if I don't want to stop it from collapsing forward like that, I'm going to have to push down on this side here. And the further that fulcrum moves in towards this second hand, the harder I'm going to have to push down to keep it balanced. And that's basically the scenario with abdominal obesity. As the weight grows out, your center of gravity grows out, and the muscle on the other side has to work really hard to stop you from tipping forward, basically. So the way to get around that is obviously try to shed off and lose that extra weight. The next cause of low back problems is high heel shoes. If I'm going to show you what high heel shoes do to your spine, I could use these wedges here, just pop them down on the floor, and just look at my low back posture as I'm standing just normally. So I'm in quite a neutral position throughout my pelvis and lower back. As soon as I step onto these triangular wedges here, you can see how my pelvis tilts forward, down that way, and that means that I really sort of need to lean my back and weight bear to the back part of the spine here. So if I try to show you that with a model, look like this, we have the pelvis in a neutral position here. As soon as you step on those high heels, the pelvis tilts forward like that, and you really sort of compresses that back part of your spine here. So the way to avoid that is, of course, limit the amount of time that you spend in high heels, especially for long periods of time. Take them off and save your back. Our next common cause of low back problems is pregnancy. When you're pregnant, obviously your center of gravity is going to move forward a bit, which causes an increased compressive load on your lower back. And on top of this, at the later part of the pregnancy, a hormone is released in the body called relaxin, which helps the body to relax the joints around the pelvis through the delivery process. So basically, when the baby is born, the pelvis opens up at the front here to make the birth canal bigger. And throughout this period, throughout the late part of the pregnancy, and just after birth, it's extremely important to have regular chiropractic care to make sure that the pelvis is balanced and straight. Otherwise, it can easily sort of twist out of position, and if it's fused back in that position, you can have back problems for years after that. So go to chiropractic regularly while you're pregnant. Our next common cause of low back problems is uneven sitting. For example, you might have a tendency to always sit down on the same foot like this when you sit down, and over the years that uneven twist on the pelvis day out and day in is going to start to misalign your pelvis and cause you back problems. And a common mistake is to always put your wallet in the same back pocket. So when you sit down, that unevenness in height always sort of push you over in one direction and creates an uneven force in the pelvis as well. And if you have to work a lot down on the ground, say you might be a carpenter hammering nails, and you have a tendency to sort of sit down the same way on the ground and do whatever you do on the ground, then you need to get into the habit of mixing the sides up. So every so often, you sit the other way. The same if you have a tendency to cross your legs over for reading, something like that, learn to use both sides, and you will stop to sort of misalign your in the balance. Our eighth cause of low back problems is spending prolonged periods of time bending forward. So say there was a Tyler, for example, and I'm sitting here fitting tiles in, and for prolonged periods of time bending forward like this, that can have significantly negative effects on your low back. Basically, you have ligaments around all your joints that only allow a certain amount of movement. But if you keep stretching for prolonged periods of time, a process called hysteresis happens. So when you normally bring a segment back to its normal position, the ligament springs back to its normal length. But if it's been stretched for a long period of time, it doesn't quite go back the whole way, and it has a little bit of extra laxity in it afterwards. And that's negative because your body knows exactly how much movement a certain joint has based on how tight the ligaments and muscles are. And if the segment can move further than your brain sort of expects based on the tension in it, it means that your brain starts to tell your body to do movements that they shouldn't really be doing. And you can actually really damage your back when you sort of has an uncalibration between what your body is actually able to do in terms of flexibility and what your brain is thinking that your body is doing. So if you have to spend prolonged periods of time bending forward, try to take frequent breaks, and after you have bent forward for a long period of time, be really careful. Know that your body is not quite as reliable as it usually is, and that you increased risk of damaging your back. Our ninth common cause of low back problems is a generally unhealthy lifestyle. Your body is in a constant process of rebuilding itself. Take my thumbnail for example, it's constantly growing. And got all blue and damaged down at the base, but in a few months it would look just as before I hit it, just from the process of the nail constantly growing and being replaced. The same happens basically with all tissues in the body, so the same would happen in your spine. So if you have a damaged surface in your spine, it will heal and regenerate itself. But to do this well, it needs all the adequate nutrients and sleep and rest to be able to sort of get ahead and do a good job with this. Because if you take the nail again, if I didn't eat a healthy diet, and as it's been replaced, it will be replaced with a brittle, unhealthy nail that very likely to be damaged again. I might not need to hit it all that hard for it to sort of break and have problems with it again. And the same is true with your back. You need to eat well and sleep well to increase the chances of a full recovery if you have a back problem. The 10th and final cause of low back problems is a lack of movement. Basically all joints in your body needs movement to be healthy. If I put my elbow into a sling and just kept like this, just even for a few hours, it would be really stiff afterwards and it will start to seize up. And the same happens in your back. If you don't move your back, the segments in your spine starting to seize up. And if I had that arm in the sling, I would also start to notice that the elbow was aching from that lack of movement, and you're feeling like you really need to move it. And the same happens in your spine, you get that ache, and that can sometimes be part of your back pain, that's ache from lack of movement. So you really need to get all the segments in your spine moving well. And sometimes it's not enough. If it's been starting to get the process of stiffening up and not moving well, the segments above and below that segment might move fine, and you can move and get the movement benefit from those, but that one segment doesn't move quite well. You really need to go to see your chiropractor to help you to loosen it up, and over time regaining the movement back into that segment. With movement you produce more joint fluid that contains lots of nutrients that maintain the health of the joint surface, and that movement also helps to massage those nutrients into the joint surface to maintain the health of the joint. And if you lack that, it's starting to break down and degenerate, and that's obviously not good for the long-term health of the joint. I really hope that you got lots out of these 10 short messages on how to better look after your low back. So enjoy them, add them in with your chiropractic care, and soon you're going to get on top of whatever problem you're currently suffering from, and good luck with it.